Female orgasmic disorder represents one of the most common yet misunderstood sexual health conditions affecting women worldwide. This complex condition, characterized by persistent difficulty achieving orgasm despite adequate sexual stimulation and arousal, impacts millions of women across diverse age groups, cultural backgrounds, and relationship statuses. Understanding female orgasmic disorder requires a comprehensive examination of its multifaceted nature, encompassing psychological, physiological, social, and relational dimensions that contribute to its development and persistence. The clinical definition of female orgasmic disorder involves the consistent absence, significant delay, or reduced intensity of orgasmic response following adequate sexual stimulation and arousal. This condition must cause clinically significant distress or interpersonal difficulties to warrant diagnosis, distinguishing it from occasional difficulties that many women experience throughout their sexual lives. The disorder can manifest as primary anorgasmia, where a woman has never experienced orgasm, or secondary anorgasmia, where orgasmic function was previously normal but has become impaired. Additionally, the condition may be situational, occurring only in specific circumstances or with particular partners, or generalized, affecting all sexual encounters regardless of context. Prevalent studies indicate that female orgasmic disorder affects approximately 10 to 15% of women globally, though these figures likely underrepresent the true scope of the condition due to underreporting and cultural stigma surrounding female sexuality. The disorder can emerge at any stage of a woman's life, from initial sexual experiences through menopause and beyond. Many women suffering from this condition report feeling isolated, inadequate, or fundamentally different from their peers, leading to significant psychological distress and relationship strain. The etiology of female orgasmic disorder is inherently multifactorial, involving complex interactions between biological, psychological, and social factors. Physiological contributors include hormonal imbalances, particularly those affecting testosterone and estrogen levels, which play crucial roles in sexual desire and response. Neurological conditions affecting the nervous system's ability to process sexual stimuli can also contribute to orgasmic difficulties. Certain medications, including selective serotonin reuptake inhibitors commonly prescribed for depression and anxiety, can significantly impact orgasmic function as a side effect. Additionally, medical conditions such as diabetes, multiple sclerosis, and cardiovascular disease may compromise the physiological mechanisms necessary for orgasmic response. Psychological factors often play equally important roles in the development and maintenance of female orgasmic disorder. Anxiety, depression, and chronic stress can create mental barriers that interfere with the relaxation and focus necessary for orgasmic response. Performance anxiety, specifically related to sexual function, can create a self-perpetuating cycle where concern about achieving orgasm actually prevents its occurrence. Past traumatic experiences, including sexual abuse or assault, can profoundly impact a woman's ability to fully engage in sexual experiences and achieve orgasmic release. Body image concerns and negative attitudes toward sexuality, often stemming from cultural or religious teachings, can also contribute to orgasmic difficulties. Relationship dynamics significantly influence the development and persistence of female orgasmic disorder. Poor communication between partners regarding sexual needs and preferences can leave women feeling misunderstood or unfulfilled. Relationship conflicts, trust issues, or emotional distance can create psychological barriers to sexual satisfaction. Additionally, partner sexual dysfunction or lack of sexual skills can contribute to inadequate stimulation and subsequent orgasmic difficulties. The quality of the emotional connection between partners often correlates directly with sexual satisfaction and orgasmic function. Cultural and social factors also play substantial roles in female orgasmic disorder. Many societies perpetuate myths about female sexuality that can create unrealistic expectations or shame around sexual expression. The persistent gender gap in sexual education often leaves women less informed about their own anatomy and sexual response patterns compared to men. Media representations of sexuality frequently emphasize male pleasure, while minimizing or misrepresenting female sexual needs and experiences. These cultural influences can contribute to women feeling disconnected from their own sexual desires and responses. Diagnosis of female orgasmic disorder requires comprehensive evaluation by qualified healthcare professionals, typically involving detailed sexual history taking and physical examination. Clinicians must carefully assess the duration and severity of symptoms, their impact on the individual's quality of life, and potential contributing factors. Differential diagnosis is important to rule out other conditions that might present similarly, such as sexual arousal disorders or underlying medical conditions affecting sexual function. The diagnostic process should be sensitive and non-judgmental, recognizing the courage required for women to seek help for intimate concerns. Treatment approaches for female orgasmic disorder are typically multimodal, addressing the various contributing factors identified during assessment. Psychotherapy, particularly cognitive behavioral therapy and sex therapy, forms the cornerstone of treatment for many women. These therapeutic approaches help address negative thought patterns, reduce performance anxiety, and develop healthy sexual communication skills. Sensate focus exercises, originally developed by Masters and Johnson, can help women reconnect with their bodies and reduce performance pressure. Mindfulness-based interventions have shown promise in helping women develop greater body awareness and present-moment focus during sexual experiences. Medical interventions may be appropriate when physiological factors contribute to orgasmic difficulties. Hormone replacement therapy can be beneficial for women experiencing orgasmic problems related to menopause or other hormonal imbalances. Medication adjustments may be necessary when current prescriptions interfere with sexual function. While there are currently no FDA-approved medications specifically for female orgasmic disorder, some healthcare providers may prescribe off-label treatments based on individual circumstances and clinical judgment. Educational interventions play crucial roles in treatment success. Many women benefit from learning about normal sexual anatomy and physiology, understanding that orgasmic response varies significantly among individuals. Education about effective stimulation techniques, including the importance of clitoral stimulation for many women, can be transformative. Partner involvement in education and therapy often enhances treatment outcomes by improving communication and sexual techniques within the relationship. The prognosis for female orgasmic disorder is generally favorable with appropriate treatment and support. Many women experience significant improvement in orgasmic function through therapy and lifestyle modifications. However, treatment success depends heavily on various factors, including the underlying causes of the disorder, the individual's motivation for change, relationship dynamics, and access to qualified healthcare providers. Long-term success often requires ongoing attention to sexual health and communication within relationships. Prevention of female orgasmic disorder involves promoting healthy attitudes towards sexuality from an early age, ensuring comprehensive sexual education that includes information about female anatomy and sexual response, and addressing societal myths and misconceptions about female sexuality. Creating supportive environments where women feel comfortable discussing sexual concerns and seeking help when needed is essential for both prevention and early intervention. Female orgasmic disorder represents a significant but treatable condition that affects many women's quality of life and relationships. Understanding its complex nature and multifactorial etiology is essential for developing effective treatment approaches and reducing the stigma surrounding female sexual health concerns. With appropriate support, education, and treatment, most women can achieve satisfying sexual experiences and improved overall well-being. Continued research into female sexual health and orgasmic function will undoubtedly lead to even more effective interventions and better outcomes for women experiencing these challenges.